For some of us, healthcare disparities and inequalities may not be something we fully understand or have experienced. However, for many Americans, especially those who have been historically marginalized and disadvantaged, healthcare inequity is expected. Healthcare inequalities can include disparities among rates of disease, health outcomes, and access to a higher quality standard of care between marginalized communities and the dominant majority.
To address health disparities, we need to understand why they exist, that they're not due to one single factor. They're the result of policy decisions we make as a society. They're due to the environment, health education, insurance and access to care, access to healthy food, and stress. Those stresses are actually experienced disproportionately by people who are poor and people who have been historically disadvantaged in this society.
According to the CDC, health literacy is the degree to which individuals have the ability to find, understand, and use information and services to inform health-related decisions and actions for themselves and others. Health literacy empowers individuals to use health information rather than simply understand it, and advocates for patients' ability to make well-informed decisions rather than just appropriate ones. Health literacy is a necessary aspect of elevating patient trust in their healthcare system. When a patient trusts their provider and the care they receive, they are more willing to engage in their own healthcare processes and behaviors that promote their well-being. Patients who are health literate are more likely to advocate for themselves and use healthcare information to make better decisions about the care they'd like to receive. Patients who experience low health literacy feel less comfortable in a healthcare setting, may misuse medication and are susceptible to health misinformation, and also may not seek and receive treatment early on. This has a major effect on the severity and progression of a disease experienced by individuals with low health literacy. As a result, people with low health literacy overall have poorer health. How can we improve health literacy among patients who have historically been underrepresented and help to lessen social inequalities and disparities in healthcare? One current solution is through genetic counseling.
But first, what exactly is genetic counseling, and what does a genetic counselor do?
Using their genetics expertise, a genetic counselor can work with you and your physician to understand your genetic risks, the tests that may be right for you, and what genetic test results may mean for you or your family. With their expertise in counseling, a genetic counselor can also provide emotional support as you make decisions and empower you with information for your overall health care. Genetic counselors can partner with you, your primary physician or specialist, and your entire healthcare team to integrate your genetic information into your overall healthcare or medical treatments.
One of the most important roles of a genetic counselor is to help families understand a disease, its progression, its treatment, and any hereditary implications. This includes discussing next steps and providing emotional support to families right after and during the time following a big diagnosis. In this way, we believe that genetic counselors help increase the health literacy of their patients. To further explore the impact of genetic counseling on health disparities, health literacy, and inequity in addressing genetic disorders, we had a discussion with genetic counselor Sophia Sulemans from Rady's Children's Hospital in San Diego. Sophia has been at Rady's for 9 years now, working with both physicians and families to convey and explain treatment plans once a genetic condition has been diagnosed. In our meeting with Sophia, she discussed her role in the lives of the families and patients she sees, particularly as a sounding board to help them understand and process medical information.
I sometimes kind of act more as a little bit more in the counseling piece, where it's more like, what did the doctor tell you about this? Even though I know what she said, but like, what it's different to know what a family heard or what a parent heard, and then kind of helping them integrate some of that information so that they're able to make a decision that makes sense for them. So like, what did the doctor tell you about this? How was that for you hearing about it? What are some of your concerns about it? Like, not in a way where you are actually, or like me as a genetic counselor, and making those choices, but more just kind of exploring or helping someone come up with those, like, I don't know, uncover what their questions might be or how they're thinking about it.
In connection with this course, Sophia also touched on her experience working with Duchenne.
And in our neuromuscular multidisciplinary clinic, I'm one of a large team of people that support the care for people with Duchenne. So I'm not always the person giving the bad news. Often it's a neuromuscular specialist who's giving like the initial diagnosis. But I am often there that same visit or sometimes the next visit after.
As a genetic counselor, a lot of Sophia's job relies on respecting patient autonomy and emotions. However, her role also involves a lot of what she calls course correcting, the process of making sure parents and patients are given medical information in terms that they can understand, so that they are able to fully comprehend their rights, risks, and treatments in the healthcare setting. She told us about one case study involving gene therapy treatment that illustrated this role.
One of our moms was really hesitant to do the gene therapy, and she said something at one visit. She said that she was like, let's just do it. I mean, if it doesn't work or there's a bad side effect, we'll just stop and then it'll be fine. And our team was like, oh no, this is a one-time medication. You can't undo it. So it's like those types of things where I might not be the person that's actually prescribing or deciding those medications for someone, but it is really helpful to know the mechanism because those types of pieces of information can be course corrected pretty quickly in a conversation if you kind of know how they work.
So would you say like to that point that you're kind of more like your role is a little bit to help people like understand the like the scientific jargon, if you will, like you're a bit like of the health literacy advocate almost, so that the patients really know what is happening?
Yep, I think so. And I think part of it is also, these are often just regular people and regular families with regular lives. And then suddenly they have this, this crash course in how medical stuff works. And it's a learned process on how to navigate that, especially if you don't have that background yourself. So a lot of people don't necessarily know that you can ask a lot of questions, or if you don't get it, that you can be like, I don't understand the word that you're using. I don't feel comfortable with this. Tell me more. And like, that's a learned process to interact with your healthcare provider for a lot of our families. So some of what I'm also doing is, I might not know the medical answers, but I might say, those are some good questions to ask so-and-so and kind of help redirect them or help guide them in how to kind of get the right information that they're needing.
In the context of DMD, Sophia was also able to implement this course correction, especially when it came to helping mothers understand the risks of being a carrier for a dystrophin mutation, in the case of having a son with DMD.
So our clinic philosophy is to really encourage carrier testing. And the reason for it is more for the health of the mother, not necessarily to just not out of academic curiosity, but more because there's cardiac screening that needs to happen. So our general philosophy is to highly encourage it, but if someone is hesitant to do it in the first couple of clinic visits, we just talk about it and talk about maybe why they're feeling that way or why they're hesitant. We haven't been forcing people to have testing, but usually when people are hesitant, it's for emotional reasons. Although there was one mother who was very hesitant to do carrier testing because she had somehow misunderstood carrier status. She thought she was actually at risk for developing Duchenne herself, just a later onset. And that is why she didn't want to have carrier testing. So I think kind of exploring it a little bit more can be helpful because there might actually be some misinformation that you can course correct.
From our conversation with Sophia, it became evident that genetic counselors don't just lay out all the information about a diagnosis or treatment. Rather, they encourage families to learn about how to get the information they want or need and help them feel empowered in medicine and health self-advocacy going forward. This is especially critical to combating health disparities, as it is families from traditionally marginalized groups that are most uncomfortable or least well incorporated in healthcare settings. It is important to have a professional voice to help them navigate and feel heard in the world of medicine, which is wrought with systemic problems such as implicit bias and lack of support for low-income or culturally diverse families in the United States. Sophia made it clear to us that above all, she protects families' values by laying out options for them without directing them down a certain route, keeping in mind that people with genetic disorders come from different socioeconomic and religious backgrounds. One medical intervention we talked about for families that discover they have a risk of passing a disease allele on to future children is IVF. When asking Sophia if she could ever recommend IVF to a family, this is the response she gave.
My role is not necessarily to make recommendations like that. It's to give people some information about what is even possible, and to maybe walk them through why someone might select one thing over another. So the reason for that is people have different values and people care about different things. And what I might pick might not be what, like, the mom I saw yesterday wants for herself or for her family. So instead, we use a bit more of a non-directive approach where we are talking about what the choices might be and then kind of guiding someone through what might make the most sense for them, given maybe their personal experience, maybe if they have any hopes for what their family might look like or not look like. Sometimes people have different religious backgrounds that they kind of pull from in these types of situations. So that's more how it works, or what we try to do. And the IVF is an option. We also talk about just having a child without any type of intervention. We talk about the possibility of doing prenatal testing when someone is already pregnant, and then doing prenatal diagnostic testing. And then the IVF is a choice as well. It's more complicated. There's more steps to it, and it also is a little bit prohibitory for some of our families because it's also expensive.
Above all, in addition to protecting patient and family values and promoting health self-advocacy and literacy, genetic counseling levels the playing field when it comes to understanding why and how genetic diseases arise. Sophia was able to touch on this, as well as the psychological trauma that can result from lack of genetic knowledge, drawing from another DMD case study.
I think that we see some families where there's been Duchenne in the family already. Like the person that we're seeing as a patient is not the very first one in the family, but there's a family history of it. And it's really curious how some families talk about it. And you can tell that they kind of came up with their own story about why it happened. And it's so often there's a lot of mystery and there's a lot of guilt. And there was a mom of a patient of ours who she just said that her mother told her to never have any boys. And she just sort of left it that way, like not a lot of explanation. And then of course this mom had 3 boys and she just was told like, don't have any. So I think there's a lot of, I think we see what happens when there's an absence of some of that genetic information or understanding about what's happened. And it's incredibly sad to see that when you also know that could have been prevented.
Genetic counseling appears to be an up-and-coming method of minimizing the impact of healthcare disparities and low health literacy by providing health education and empowering families, making them feel capable of navigating tough diagnoses like DMD. While it could take a lot of time and resources to implement genetic counseling in more clinics and hospitals, it is just one example of what could be an incredibly worthwhile endeavor, as healthcare inequity remains a significant problem in the U.S.
Addressing healthcare disparities in the United States is necessary so that everyone is elevated to the same standard and quality of care, ensuring that every individual has equal ability and fair access to determine their own health and their own care, regardless of social, economic, or racial factors. Furthermore, healthcare disparities result in economic impacts that affect patients and their families both individually and socially. In England, early mortality due to health inequality results in a loss of participants in the workforce, which can have a downstream effect on the local economy. Individuals and their families who experience inequity in healthcare may be inhibited from participating in the workforce, which is detrimental to their economic outcome and hurts society's economic productivity. We can also consider the economic significance that decreasing health inequality would have on annual healthcare costs in the United States. Per The Economist, if these disparities were eliminated, the United States could have saved approximately $230 billion in direct care costs and $110 billion in indirect care costs. As aforementioned, minorities may refrain from visiting their healthcare providers due to distrust or underrepresentation, and as a result may only visit once they are experiencing a true health crisis. Moreover, preventative measures and education can help inform better health literacy so patients feel more comfortable advocating for their health care. Not only does health inequality have detrimental effects on people's health, well-being, and livelihood, but it also has massive economic and fiscal consequences, siphoning financial resources away from more pertinent purposes. Acknowledging healthcare disparities in our society is an important step in working towards creating a healthcare system that is inclusive of all people, regardless of culture, race, or socioeconomic status. Reducing these inequities and inequalities will contribute to a better and more compassionate and inclusive society overall. Though the solutions to solving healthcare disparities are systemic and cannot solely be solved within the healthcare system, new clinical practices can be adopted to help reduce the impact of health inequality. These include documenting and respecting pertinent patient care characteristics like their racial group, gender identity, and any language barriers that may be present. Practitioners can also screen their patients for social risk factors that may affect their ability to access or receive care, like food insecurity or housing instability. Acquiring these patient characteristics then allows the healthcare system to adapt their model and tailor their outreach efforts within the community to disadvantaged groups of individuals, earn the trust of their disenfranchised patient base, adapt treatments to consider social and cultural desires and needs, and finally to work with community partners to better assess the needs of the community.